deficiency of these endocannabinoids, which can fluctuate for a whole range of things, changes with exercise, eating, sleeping, and that. But a deficiency can actually be linked with certain disease states, which is why then when we start to look at medicinal cannabis, that we have certain cannabinoids such as THC, CBN, and a few others that actually bind to our CB1 receptors in particular. Some of the others bind to CB2 receptors and then help to function and balance out some of these endocannabinoids, which can have like a major effect on our body.
Welcome to the Smarter Not Harder podcast, your home for 1 cent solutions to $64,000 questions. I'm your host, Jodi Duval. Our guest on today's show is Dr. Janet Schloss. Dr. Janet Schloss is a clinical research fellow at the National Centre for Naturopathic Medicine, Southern Cross University. Janet is an accomplished researcher with extensive experience in coordinating clinical trials. In addition to her academic career, Janet is a practicing clinical nutritionist and naturopath with over 20 years' experience. Following the completion of her doctorate in 2015, Janet has focused her research on supporting people who have cancer through studying the use of complementary medicine to assist side effects of cancer treatments. Janet has completed a number of groundbreaking studies and has over 60 publications, and now focuses a lot of her research on medical cannabis. So what did we get into in this conversation? First up, we explore what initially sparked Janet's interest in medical cannabis and how the field has evolved over time. And we discover how this once stigmatized plant has gained recognition as a powerful tool in healthcare. Next, we dive into Cannabis 101, uncovering the intricacies of the endocannabinoid system and its impact on our health. Prepare to be amazed by the potential applications of medical cannabis in the treatment of chronic disease and conditions. And as we dive deeper, we discuss the challenges of designing research studies around medical cannabis. Janet shares her first-hand experience and sheds light on the hurdles faced during this critical process. But that's not all. We also explore exciting, promising research studies, discover the unexpected findings that have emerged from Janet's work and how they are reshaping our understanding of medical cannabis. Janet's passion for improved patient outcomes and accessibility shines through as we discuss advice for patients interested in exploring the potential benefits of medical cannabis. And we explore available resources and empower individuals to make informed decisions about their health. Lastly, we peer into the future and uncover the exciting developments and opportunities in medical cannabis research. But that's not all. We also touch on antioxidants, practical applications of cannabis for everyday use, and much, much more. So if you're curious about the potential of medical cannabis, its impact on chronic disease and the future of this field, then this episode is for you. Let's dive in and explore the world of medical cannabis together. Welcome, Janet. So everyone, we have Janet Schloss on the podcast, and we are going to talk all cannabis and everything else. Welcome, Janet.
Thank you so much, Jodi.
So, Janet, I want to start for an introduction for those who don't know you. Tell us a little bit about you. Now, I have a feeling that you might have been something to do with sport early on.
Yeah. Well, I did not see that one coming.
Well, there's that, but also what brought you into this field of nutrition, herbal medicine, cannabis research? It is vast for you, an international speaker, and I want to talk about your trip after you tell us all about you.
Yeah, no worries at all. So yes, I used to be an Australian indoor volleyballer and beach volleyballer for quite a few years, and then I retired when I was 30 years old. So, and
did you play for Australia?
Yes.
Oh my goodness, Janet.
Yeah, so I was one of the founding members actually for the indoor volleyball team that was actually based in Perth, Australia.
Wow. Well done. That's incredible. The fitness level for that. Oh my goodness.
Yeah, definitely don't have that these days.
A lot of muscle memory.
Yeah, menopause isn't nice.
No, I've heard. Something to look forward to.
Absolutely.
So what brought you then from that into a field of complementary, I don't know what we call this, alternative medicine?
Yeah, so I was still in the volleyball world, and I was actually also working for, at that stage, Queensland Volleyball, and really got to a point that I started looking and saying, this isn't what I want to do for the rest of my life, and I don't want to work in volleyball for the rest of my life. And my real interest was really in natural therapies and nutrition, probably more nutrition than herbal medicine.
Okay.
So at 27, I turned my life around and went back as a full-time student and studied naturopathy, which I think was a really good move for me, and then started practicing and really got interested in particular for oncology and looking after oncology patients. And I was working part-time also for Bioconcepts and with Henry Osiki, and I said, I think it would be really good to have just a straight oncology book. So from there we started writing, and the nutrition, biochemistry and cancer book was formed. So
we were just looking at that the other day, actually.
Yeah, that was like 2001, I think the first version came out. So a long time ago, lots of things have come from there. So, and from that, I really took a big interest in oncology and started learning and talking to more people, because it's not something I think you just can like suddenly say, oh, I'm interested in oncology and start treating people and stuff for. So that gave us a really good basis on looking at research, and particularly nutrition research for oncology. And then I started interacting a lot with more medical oncologists and started going more in towards that world, and then ended up doing my postgrad in clinical nutrition, RMIT, and then into a PhD at the School of Medicine, where we started looking into B vitamins for chemotherapy and peripheral neuropathy. So I sort of really did a lot of medical studies then in the oncology world, and in doing so, really that's my focus in what I do in clinical practice. But it also gave me the skills to be able to conduct clinical trials, which is key, because that's something that I'm really very passionate about. And in doing so, I had a lot of my patients coming at that stage doing black market cannabis. So that really sparked my interest. And then I was presenting at an AIMA conference, which is the Australasian Integrative Medicine Association. And I was presenting on chemotherapy and radiation and complementary therapies that have been researched into that. And while I was there, Justin Sinclair also presented his work, and he's a good friend of mine, on cannabis. And we had been talking behind the scenes, as well as I've been talking to Andrew Whitfield Cook, who had been working at Bioceuticals at that stage. And they're all sort of pointing me into the direction of, getting into the cannabis research and looking into it a bit deeply. And at that same conference, Charlie Teo was actually presenting. So came up to him and I talked to him later, and I said, look, this is my idea. I said, what we've actually found, is a lot of the research in cannabis at this stage is on brain tumours, particularly glioblastomas, GBM, which is the most aggressive. And he said, well, let's do it. So I know. So from there, my research into cannabis really did a big, deep dive in, just from like looking at behind the scenes, doing a bit of research, like literature reviews and stuff like that. And was able then to conduct one of the first trials on medicinal cannabis for GBMs for efficacy and tolerability.
Amazing. What year was that study done? That was not that long ago.
No, we concluded at the end of 2019, which was actually very lucky before COVID hit.
Just before? Yeah.
So, which is great.
Incredible.
But in doing so, we were then able to present a lot of the results because everything was closed.
So your trip that you've just done, Europe and UK now, just at the start of the year, was that to do with those particular research projects or a wide range of?
So over in the UK, I presented three times. The first one was actually to the second clinical trials symposium on medicinal cannabis. And the funny thing is, like the first one was in 2019, which I went to. And then this was the second one. It was the first time they're able to bring everybody together. So I actually presented our research on the the cannabis and GBM trial, but at this stage we also had then completed all our pharmacokinetic studies, so which was looking at, you know, what were the individual reactions, but not only to the cannabinoids that were in each of these different time points, but also the endocannabinoids. And we also had our survival data 2.5 years post-trial, which basically showed that 47% of our patients were still alive in prognosis that had 6 to 12 months, max 18 months from diagnosis. So I was very lucky. The second one I presented was actually at the Isle of Man, and that was on breast cancer and nutrition for the METS breast cancer group.
Okay.
And then the third one was to the University of London School of Pharmacy, and that was actually on cannabis and turning it how we look at like herbal medicine and stuff into trials and into basically into drugs that people can then use.
Incredible. I definitely want to talk to you about that further on in the podcast. Firstly, though, inquisitively, how was cannabis perceived by the medical world and by you even when you first heard about this with the clients coming in from the black market cannabis, and obviously hearing how beneficial it can be, but there has been so much dogma or stigma around cannabis for so long, and still even now when you talk to people, what was your initial perception on all that?
Yeah, like it's interesting when I first started, and I will say that some of that has actually shifted now. But initially, we had a lot of opposition from particularly the medical oncology area, mainly because obviously there's the fact that we were looking at some form of efficacy, like big red flags, but also because of the person who I did it with, which was Charlie. You know, he's quite targeted by quite a number of medical fraternity, including medical oncologists and radiation oncologists. So all up, that sort of makes it quite a controversial mix. But you know what, he takes risks. You know, medicine can't move forward if everybody stays in that traditional conventional side. So taking those steps out allows research to actually occur.
Absolutely, it has to. And it takes those really gutsy people, and it can be so baseline when you get into trouble. You feel, you know, it's that horrible fear. And for someone to move through their career always having that fear, it's so stressful. But the passion and the drive to move forward is just incredible. And those who do that are the most successful in terms of what they achieve for the medical fields or for the patients or the clients that they're actually doing this for, which is huge.
I totally agree with you for that.
Yeah.
So for me, I was also skeptical. I'm going to be really honest. You know, I actually thought that there's definitely the potential that it could help some people, but at that stage, you know, really, like when I first started, so was that the trial conception stuff was like 2016, 17.
Yeah.
The conceptualization and that stuff of it, you know, there's so much there's even today, we still watch, we don't know, but the more trials and stuff that we can continue. So it really gave us a good opportunity to see, you know, yes, it does actually work for certain people, but not for others. We're still uncertain as to why. It definitely does work for people who are their disease is very far progressed. So, but I do believe that it has so much potential now, and these days, obviously, it's becoming a lot more popular and a lot easier to get, which is fantastic, and that's done through a lot of advocacy work.
Yeah. And
I think that the perception in general for most people is a lot more open. And we even see some of the people today, you know, I have more people like recommending, like even radiation oncologists and stuff were a bit more reserved, sending people and talking, getting me to talk to them about medicinal cannabis. They know that I am more measured and know that I'm not always going to recommend it to everybody because I don't think it's still right for everybody. But I think it really should and will play a solid part in our medical fraternity.
Yeah, and I think the legalization of it over in other countries, as well as you say, the availability and the training that's increased for a lot of medical professionals to actually be experts in that. I think that's really helped the field along, like you say, the advocacy to actually push it forward. But I'm sure you still get pushback to this day, even in practice. I'm sure there's people that will still stand up against you and say this is not right.
Oh, absolutely. I still definitely have people, obviously more the medical fraternity more than the patients themselves, but I still definitely have a lot of people who stand up and just, they know and are negative towards me and still have a lot of opposition.
Yeah, absolutely. All right. Well, let's talk about cannabis and the endocannabinoid system. We'll do like a quick 101 because
God.
well, we can't really because it is quite complex. And when I did my initial research on this, and I have created a small little unit just to help people and obviously myself as well, with Home Hope, which is a health optimization medicine and practice. And I found this beautiful diagram in the research, and it was endocannabinoid, and it was the interaction between the endocannabinoid system and the rest of our body. And it just fascinated me. I stared for hours at this diagram. So I love the term endocannabinoid. It really brings it together between that intersection of where the endocannabinoid system and that interaction and where we lie within that, and how interconnected and why it's so important and so effective, I feel, the medicine. So talk me through the endocannabinoid system. It's it's one of the newest systems that we know about, and that blows my mind in itself. Yeah. So let's start there and then move through how cannabis itself interacts and impacts onto the endocannabinoid system.
Yeah, no worries at all. So the endocannabinoid system, you're right, is our newest system that has been identified, and unfortunately the person who actually identified it only just passed away recently, which is Ralph Moorman, who was the father of cannabis as well. But it was such a great find, the fact that we have these natural endocannabinoids within our system that act basically the same way that cannabis can, and not just the THC high status or the other actions that this actually occurs. And what they actually found is that we have two receptor sites, which is CB1 and CB2. And the CB1 is predominantly within the brain, the spine, and in certain organs. And the CB2 is more the peripheral and immune type system. Yeah. And what they found is that predominantly there is two endocannabinoids, which is anandamide and 2-AG, and they bind to those receptor sites and stimulate that CB1 and CB2 action. Okay. We then have what's called NACs. So we have three other ones, which is PEA, SEA, and OEA. And they also work within our endocannabinoid system to actually help different functions. So these things can make us feel like hungry. It can make us feel happy. It can make us feel tired. It can make us feel flat. It actually works on so many different levels within our actual body. So there's been a whole range of research, and I've actually got a number of students who are also looking into and testing these endocannabinoids to see and to check on some of the theories, because what they've actually found is that, deficiency of these endocannabinoids, which can fluctuate for a whole range of things, changes with exercise, eating, sleeping, and that, but a deficiency can actually be linked with certain disease states, which is why then when we start to look at medicinal cannabis, that we have certain cannabinoids such as THC, CBN, and a few others that actually bind to our CB1 receptors in particular. Some of the others bind to CB2 receptors, and then help to function and balance out some of these endocannabinoids, which can have like a major effect on our body. So,
was it Dr. Ethan Russo that brought that to light? It was I read something on his research that was also to do with this tone of the endocannabinoid system.
Ethan Russo did actually bring forward the idea and concept of the tone, and also the deficiency concept of it, and he's definitely one of the most amazing researchers in the cannabis world.
Yeah, and a beautiful writer as well. I feel like he portrays it in a beautiful way. Yeah.
Yes, he does.
Yeah, yeah. Okay, incredible. So Then with the different with the different cannabinoids now, as they bind, obviously, talk us through what then happens with that. You know, does it get to a point where we don't need to have them anymore? Is there, obviously, there's certain things that each cannabinoid does, and we can go into that as well and how we separate that. But maybe a little bit more information about that sort of thing with the receptors.
The thing is, there's a certain amount that we know and there's a certain amount that we don't actually know. And we now know that there's over 140 different cannabinoids, but then there's also your terpene and stuff that are within the cannabis plant. So we're looking at 300 to 400 different components in one plant. However, there's only a certain amount of cannabinoids that actually bind to the receptor sites, which is one of the things, like I said, like we've got the THC, which definitely binds to a lot of the CB1 receptors. And that's where we do actually have some of that psychotherapy type of effects or high type effects. CBN, which is now starting to be used quite a lot for sleep and stuff like that, is like a precursor, or it's a separate cannabinoid that also binds to the CB1 receptors, whereas we've got CBD, which doesn't actually bind to the receptors at all, but has a completely different interaction within the body. So just said, there's really what they're finding is now they're starting to drill down into the different cannabinoids, which one does actually bind, which ones don't actually bind, and what are the different actions and stuff of them. Yeah,
fascinating. And then obviously herbal medicine is a big part of your profession as well. And I love that, obviously we try not to isolate too much, because the synergism between this plant and also the herbs that we prescribe, and even the combination of certain things where we combine nutraceuticals with herbal medicine, there's this synergy, this art to how we treat. And I feel that although we need to research and we need to drill down into the individual components of these plants, sometimes we take away the magic, I guess, of how they act on the body. What's your perception of this? Like, what's your opinion?
Such an interesting thing. Like, the entourage effect is actually being debated.
Yeah.
Currently saying that there is an entourage effect, and no, there's not an entourage effect, which I find very interesting.
Yeah.
In itself, we've always thought that there always was. So, but I think that a whole plant and a synergy is actually required. So for me, I think that using the whole plant, and even with all our research and stuff that we've actually done, we've actually identified that the actual synthetic forms that are currently on the market and being used don't have the same effect as what a whole plant has. And that's now quite well known, although on a pharmaceutical side, it's much easier to represent or make a synthetic form of just one component, because that's what drugs do, having to deal with this whole entourage and complexity of a plant. And I think that's what's made it a bit harder for some people in getting their head wrapped around it, because even when companies are trying to make it, there's always a leeway, because you can't make exactly the same batch every time.
Absolutely. So, the current cannabis products that are on the market at the moment, from a pharmaceutical perspective, so you're saying that the ones that they're creating, obviously they have grown certain, so I saw a few of my clients come in and show me their packets and beautiful CBD only herb. So what's your perception on what's been provided by the pharmaceutical versus what we could have out of the whole plant?
So there's the different with TGA, and I will actually say most of the products, if you want to products or drugs, that are on our Australian market through the SAS CAP program, are still actually all made from plants. They're not synthetic. And that's actually really important to know. So yes, we have different categories of Schedule 1 down to Schedule 5, which is a high CBD or CBD only, down to a THC-based one, but they're still extracted from plants.
Okay, good.
And the CBD is then extracted out to make a CBD-only product. Now, the CBD-only product is 98% CBD. There's still 2% that is other cannabinoid, but they just can't be THC. So Schedule 2 is then like a higher CBD to THC ratio, and then it goes down. Each of these plants or products are actually made from whole plants, and then they're regulated to have a certain amount in that for them to be able to put into a bottle. So there is still a certain playing around and stuff like that, but they're still plant orientated. I think that in itself is really important.
Okay, absolutely. Yeah, absolutely. Because there's a lot of misconception out there or assumed information. And I feel like it's really good to have it all clear, especially when people are going to be a little bit unsure about taking the medicines in itself. You know, in my clinic, I'm suggesting for multiple conditions to have certain cannabinoid products, and then obviously go through the main companies and the doctors that are supplying that so they can have a proper prescription, which is beautiful. But still there is some uncertainty around all of that. So, yeah. Now, I want to jump in, move forward and look at some of the, and I'll dive a little bit more into your research, but let's just finish off that look at cannabinoids and endocannabinoid system. Where are the most promising applications do you see for cannabis in chronic disease or other, conditions that people are experiencing on a daily basis? What are your do you have any categories as such? How can we look at that?
I would definitely look at that. So for me, for chronic diseases, I think that obviously there's already a high application in oncology, which is considered to be a chronic disease. I definitely think the rheumatology area, so like fibromyalgia and some of the arthritis and stuff like that, I definitely think that it can play a very big part in that. I think that we would have to be careful with things like diabetes, mainly because of the complications that come in regards to it. I definitely think that there's a huge application in neurological type conditions like Parkinson's, MS, motor neuron disease, some of the autoimmune diseases and stuff like that, all of which are major chronic conditions.
Absolutely.
And I think that cannabis could play a huge part in that.
Absolutely. So then we also have the conditions of stress, anxiety, inflammation, and I think CBD and obviously pain, any pain condition like you've mentioned already. But I think for people, and that's where I've seen, now I've got the croaky voice, that's where I've seen a lot of my clients benefit is through pain and different types of the cannabinoids, THC and CBD combined can be really beneficial, and dosing obviously individually is amazing for them.
I totally agree with you in regards to stress and anxiety. I think that plays a major part, and I definitely think like a CBD component comes out really, really well. The Lambert Institute have just come out and with a really good paper showing 300 milligrams of CBD is highly beneficial for people with anxiety.
Yeah, incredible. That's amazing. And you feel it, I feel it in myself. Once you have an indication of something within yourself, then it's hard not to shout that. When you feel that it's so dramatic. Yeah. So in terms of the research that you're doing with medical cannabis, what do you see? What comes up? What are the issues that are surrounding the research within medicinal cannabis?
Again, from my first research project to all the ones I do now, the actual logistic of it has been lifted so much.
Good.
So like that, the layers of legal problems trying to get through to run a clinical trial on medicinal cannabis has really been lifted. So much easier now without having to get each state health approval, having to go through a pharmaceutical type requirements as well as the TGA. So all of that has been lifted dramatically, like I said. So to actually run a clinical trial, it is much easier. One of the biggest things really is the ethics requirements, and a lot of ethics, like the HREC requirements for it. It's getting their head around the logistics and what that actually implies, but it's still very hard for them to understand. We incorporate a THC-based one because obviously there's still implications for people driving. So people who are actually on a trial, I've got a PhD student who's about to run a trial on fibromyalgia on a 1-to-1 formula of THC to CBD. So people on the trial basically are told they're not allowed to drive during this period because of the THC. So
Yeah.
part of our advocacy group is really pushing to get this re-looked at, in particular for impediment of driving, you know, when there's other drugs that people can actually be putting them on. And at this stage, luckily, we've got Victoria, who's now changed the rules in regards to having THC in the system, and as long as they're driving without impairment.
Yeah.
So we're hoping then that we get more states on board, and hopefully federally as well, because that makes obviously running clinical trials with THC in it so much easier, because a lot of people don't want to be involved because they can't drive.
Exactly. There's a huge limitation there. Yeah.
Yeah.
So there needs to be measurements and, you know, all sorts of paperwork done on what impairment is. So I can imagine it can be a very lengthy process.
Absolutely. But, you know, there's quite a number of universities and researchers in this space in Australia, which we're actually leading it at the moment, not SCU, but two of the other universities. And, you know, I think the research that they're doing has really been prudent in being able to influence this policy and change.
Yeah, absolutely. And it's just incredible that the amount of research that's coming up, that has been done, that is driving forward. It just shows how incredible this medicine is.
Yeah, absolutely.
It's just, it's so much happening in the field. It's amazing. Yeah.
Yes.
So when you're looking, obviously we've talked to a few research studies that are coming. Anything that's incredible that you're really excited about? Like I would be excited about this fibromyalgia. That's amazing. There's so many people that are suffering with fibromyalgia, and it's the suffering that is the problem. So anything else that you're seeing in the near future that's really exciting for the cannabis world?
Yeah, look, there's a number of ones. For me personally, the fibromyalgia one is something that I've been working with some of the rheumatologists now for quite a few years, and it's so good to finally see that it's actually coming to fruition.
Yeah, absolutely. Because it's not long ago that fibromyalgia was still all in your head.
Oh, I know, right? Now it's least recognised as a condition. Some of the other areas that I think that's really exciting that is coming up. I mean, there's lots of work at the moment on, because of Schedule 3 or down schedulation of the CBD. So lots of research in that area for like sleep, anxiety, psychosocial type responses. So I think that's actually good, so that we'll see some of that coming out. But I think the more exciting parts of the cannabis world really is more, like I said, that neurological type ones. Yes, you know, a lot of the studies have been done on epilepsy and specialised epilepsy and now Tourette's, but there's now starting to be more of a focus on Parkinson's and MS and autism. So that autism and ADHD area, I'm very excited about. You know, sort of still, even though I said most of my stuff is oncology, and I still think that plays a part. I think there's big gaps in this neurological aspect. And for me, I think that's is a big gap that I really want to work in, which is I've actually started to delve a little bit more.
Incredible. It's needed. There is so much new diagnostic or diagnosis of ADHD and even autism. I'm seeing so much more come through my clinic. I'm sure you have too. Yeah.
Oh, absolutely. And particularly with the new classifications of female ADHD, which was never really documented and stuff before. And it really makes sense for so many people now to actually see the difference between the female and male ADHD symptomology. Yeah. And in doing so, I think there's a lot of females in particular getting a lot of benefit from that. And, you know, some of the medications that they use for that is not very nice. It has lots of side effects. It doesn't sit well with a lot of people. And that's to say, cannabis can actually fit in a really nice spot for there, without a lot of the side effects that they're currently seeing. So that's, and with, like you said, the huge amount of people that actually have it, I think this is, to me, a really exciting opportunity.
Oh, amazing. So with obviously cannabis products, CBD, from my understanding, it's exciting also in that you can take it in conjunction with a lot of different medications as well. So I think that in itself is fantastic for people to also know, because they sometimes assume that if they are on one form of medication, they can't be on another. Like cannabis, but from that, in a sort of a segue leeway into your own practice, obviously oncology is the main focus of yours, I believe, in your practice. Where do you find some of the, even any success stories or anything there that you want to comment on what you're finding within your practice at the moment in what people are saying and to do with the cannabis world, obviously.
Yeah, it's quite interesting. And then, it's not just the CBD. You also have to look at what like the THC interacts with too, which is slightly different to just a CBD type product. And we do find that you can use it a lot in conjunction with different drugs, including like chemotherapy agents and radiation and stuff like that. So there is a lot of overlap that can actually occur. We still do need to be more specific with some of the new drugs that are coming out, because we have found obviously that some of the immunotherapies we can't use cannabis with.
Yeah.
So, and that's more because of that certain mechanism of action. And I'm going to throw another little thing in here, which I find very interesting, is that the microbiome has also been found hugely involved with immunotherapies, especially in the cancer side. So, and at the moment, they're trying to figure out, if it's more beneficial or detrimental to be able to use probiotics and different things with certain immunotherapies. Now, looking at an oral cannabis that also has an impact on microbiome, that in itself, I think, is another area that needs a lot more research, which I think could show like huge benefits in increasing drug efficacy in certain people.
Yeah.
But we don't know that with yet.
Yeah. So much more to explore. Like you say, we're only touching the surface of even the human body. If we can create or see new systems in the last 50 years, then what else are we going to discover in the next 50?
Oh, I know. But like even over, I would say the last 10 years, the research has increased exponentially in so many different areas.
Yeah. It's so exciting. It's so exciting in the field of all research. Absolutely. So with your clients, patients, interchangeable there, with their, in terms of chemotherapy and adjunct treatment with cannabis products, it can obviously aid through these therapies and also help with symptoms of these therapies. Give us a little bit more information of what you're finding there.
Yeah, so what I've found particularly with some of my patients, and it depends, some will actually just take it while they're having treatment, and it definitely does like have the symptomology thing, so it definitely helps to reduce some of the nausea. It increases their appetite. It actually helps with their sleep, particularly when they're on steroids. It reduces the anger and irritability that occurs when people are on dexamethasone and prednisolone. So that actually has like all beneficial type effects. And I think for most people, that's actually good. There's definitely some people who don't tolerate a THC-based product, so that CBD then can play a major part. And then there's others that will continue to take it afterwards as a preventative. And the majority that I have afterwards are predominantly brain cancer people. And nearly all of them have actually had really good results. And I will actually include some of the little kids in that as well, with brain tumours. So with quite phenomenal type results. And one, be careful with what I say, but one has a mother who is a lawyer and has gone really on to that, and her child has actually had a fantastic type response and continues on cannabis. And there's still a worry about, cognitive influences, but you've got a brain cancer that has a very poor prognostic outcome. You do everything possible.
Absolutely.
A lot of the other ones, I find after like a little while on cannabis as a preventative, they end up sometimes just stop taking. They feel, I think, to a certain point that, it hasn't come back. They're actually doing really well. And also the cost of it. Yeah. I think comes into play as well. So I have a real mix in clinic of what happens. But in general, the majority of them will actually ask me about it without me even bringing it out.
It's becoming a lot more widespread in talking circles and also chat forums and things like that, which is, I think, brilliant. But yes, you're right with the cost. A lot of people do comment on the cost, and I do wonder if the more popularity comes, the more research comes, the price will actually start to reduce. I hope so. There is that one of my clients said, well, it's sort of the same as the street versus the prescription price. And I'm like, well, I guess that's a good thing, isn't it? But it means that you should just go for the prescription one that you're actually guaranteed what's in that, because that's another risk factor, right?
Oh,
We know
absolutely.
sprayed, grown, organic, again, cannabis in itself is one of these moppers of the soil. So it could take in whatever's been sprayed into the soil, which I found fabulous about and fascinating about cannabis is that the way that it grows, the way that it interacts with the environment, that in itself is just incredible.
Absolutely.
So we have to be, I think, so careful of what we're getting, who we're getting it from, if they are going out to do that through the black market. It can be some scary things that are attached onto those.
Absolutely. And it's quite interesting. Like a lot of the people on that product in the black market, they'll say, I've got CBD. And when I sort of dig a little bit deeper, I find out they really don't know what's in it. And most of them actually have THC based things. They call it CBD. So the black market is really have no idea what you're actually getting. Majority of the time.
And I think a lot of the time it's almost wasting their time too, because dosage and effectiveness of that dose is probably not even worth taking. I've consumed some of it, I've tried some of it. It just tastes like olive oil sometimes, the CBD. And then you taste a real CBD product, you know the difference. It's huge. So, it's almost like it's a waste of time and money, really, if you're not actually getting the dose that you need and you can guarantee that dose. Yeah.
I totally agree.
Yeah. So first of all, I think I honour you, and I am so in awe of those who can spend time in the field of oncology for multiple groups of people, including children, and see the suffering and actually have day by day in a clinic and see these people. I think it's a huge, an amazing field to be in, but for energetically as a person, as a practitioner, it's so hard. It's so hard and emotional. And I myself have, inklings of clients where they'll come through in huge amounts of suffering. And I struggle, I really do. And I know a lot of the health fields, including nurses and doctors in the emergency sense, see so much, and we do get accustomed to it. But in our field, particularly when you're so in tune with the energy and the energetic components and herbal medicines and, nature in general, you can't help but feel so much for these clients or patients. So thank you first, because I feel that that's something that has to be said, because it's so hard and I feel for you.
Oh, thank you.
It's I don't think it's said enough and not recognised enough by those outside of, and that's why I feel when there is a targeting of some sort, when you're having to deal with people who are coming up against you, I'm like, well, just consider for a fact of what actually you have to go through on a day-to-day basis, and actually see and hear and not have come back some of those clients or patients, and it's hard. It's really, really hard. Yeah.
Yes, it is.
So from that point, let's talk into a little bit more general outcomes and a little bit more practical aspects of those out there with no chronic diseases as such, although we do have so much, and most people also are not aware that they have some of these conditions unless they're getting tested well for it. What are the practical things that you would tell people about what cannabis is for, what they should be looking for, where they should go to search out information, where are the education pieces? Because Google is, as we all know, it's a rabbit hole, and I don't think it's a very good rabbit hole most of the time unless you're looking for the research and know how to pull that apart. So, Janet, tell us a little bit more about your information that you normally tell people about all of that.
Yeah, most people who come to see me, they start talking about cannabis, obviously have done lots of Google searches and have all this anecdotal information of what people are telling them and stuff like that, which isn't always right. And so first off, it's actually clarifying what medicinal cannabis actually is and why you would actually use it, and demystifying the stigmatism, which is what you're referring to and stuff as well. I also talk to them, regarding to, medicinal cannabis isn't always the right thing for you at some stages. So we have to work out if it is, the right thing for you to take right now, or not. Obviously, there's certain things, like liver enzymes and kidney function and heart disease and stuff that needs to be looked into, what medications that you're actually on, you know, where are you in what you're actually experiencing for it. And, you know, then you also talk to them the differences between CBD only type products versus THC, the driving components. So try and educate them a little bit as to not only about what I've just said, but also the reasons why they would actually take it and what their expected outcomes actually are. I do talk to them about the black market versus like proper scripting, and most people definitely want to have it done legally. So, and then I actually have a number of contacts with people who I will then give to them and say, look, I think like these are my suggestions of people that you contact to actually go through who I feel confident and stuff with.
Yeah.
So on a practical side of things, I make sure that it's covered, that they're educated. I talk to them about some of the research stuff that we've actually done or what I actually know, and then direct them to people who, like I said, I feel actually comfortable with then getting scripts, because I will be really honest, is that there's a lot of people out there that I will consider to be a bit of cowboys, giving out scripts with no real understanding of cannabis other than what they're actually told, like that education piece. That's one of the reasons there's quite a number of doctors who don't want to prescribe it, because they don't feel confident enough in their knowledge base. And I think I give them full credit. Yeah. So if that's working within their scope of practice, a lot of them are not against it, but they're happier if you go to somebody that then knows more about that particular drug. So Absolutely. There's also a lot of people who've jumped into it without getting the proper education and understanding and stuff of it. And then they'll say, look, I've prescribed blah, 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 so many, but do you really understand what the implication is and the nuances and all that type of thing? So I think that to me is actually really important, to feel comfortable with who you recommend for people to go see.
Absolutely. And that it can be so limited at the moment, I feel, for some states, particularly in Australia. America's a little bit different, which I will talk to you a little bit about in a minute comparatively. But I feel, even those who I've sent to, some of the doctors, I feel there's not a lot of education around titration or where they should go. And I think this is a medical field, unfortunately, in general, is that, you can go in for a heart surgery and you come out of it with no information and know where to go. And I think almost with cannabis, again, I think the lack of information, the lack of time with patients and clients, you have no idea what they're, I spend an hour with a client, I'm sure you do too, or more, and all their ins and outs, their lifestyle, their interactions, their poos, their wheeze, their everything, their function of the body. So the details of what is required and also the monitoring of what is required for that person, whereas that's missing. And so you will never know the details that you need to know from a test, I feel, if you don't combine that with that patient knowledge and monitoring. So my next question is titration, because I feel cannabis is so nuanced in the way that we prescribe and dose, or posology as I call it. I feel that is so different, and I think scary also for medical professionals, because it's very different to pharmaceutical prescribing. So talk me through that, Janet.
Yeah, look, I totally agree. And this one in particular is quite difficult for medical practitioners to get their head around. It's exactly what you just said. It's completely different to how they would normally prescribe. And the individual ability of that person varies. So individual variability is massive when we're looking at cannabis. And as I said, for some people, they don't tolerate the THC component at all, and that needs to then be changed. So to me, it needs to be a very slow, you take it steady and slow in titration for everybody, not just one person, until what we consider to be finding tolerability. And that means it's a sweet spot where they're getting benefits and stuff from with hardly any side effects.
Okay.
So, and that will vary. I've got some people that are on extremely low doses, considering for some. And I see also a lot of the doctors trying, giving higher doses, and I'm just like, you can't do that. You have to really start low and just see how they go. And yes, if they don't feel any difference, you can increase that titration a lot quicker. You can then do it, say, every day until they start to notice, and then you can spread it out to keep on that dose for every 2 to 3 days, get to another one maybe. So there's a lot of, I think, interaction that needs to happen when people are actually getting put onto it, and not just given a script and say, this is how you titrate up in the next month, and then I'll see you then.
Yeah. So with normal pharmaceutical medicines, it's like, take this dose, we'll check in, but then you're on it forever, almost, for some of them. Whereas this, do you feel obviously it varies between person and person, obviously, and also from cannabinoid to cannabinoid. For some, would you say that you titrate up, you stay steady for a little bit, and then you can titrate back down again?
Yes.
And that would be more of the receptor-based cannabinoids, am I correct?
Absolutely. Yeah, like you've definitely seen where, and you're right also about the different batches as well, so they can get put onto another batch and then get a completely different response, even though it's from exactly the same drug. We're actually given just a different batch. But we have found for a number of people that they titrate up, they stay there for a little while, and then it starts to change, and we titrate them back down again. And you're right, it's about the receptors, it's about the interaction of the endocannabinoids, it's about what's actually happening to them at the time. So it's not something that for some people, yes, they can actually stay on one particular dose for a long period of time, but for others, that doesn't always happen.
Yeah. Which is, I think, the plant itself is trying to get us to be more individualized in our prescription and interaction with clients. Because I'm like, oh, you're one clever little plant here.
Absolutely. Like even with other herbal medicines, it doesn't actually work with that. But I love it because it's so patient-centered. And, that's the way it should be.
Yes, absolutely. Now, I have one more question in terms of patient-centered practice here with cannabis, is that THC, we have an interaction, obviously, with some of these psychiatric issues. So schizophrenia can be something that can be triggered on a genetic level with THC. Do you normally do any genetic testing with any of your clients or patients?
I personally don't for it, in regards to schizophrenia and stuff like that. However, I will actually work in conjunction with a medical doctor to be able to do that.
Yeah. And it would obviously be a question of prior family history as well, and obviously history, that's what you would normally be covering off. But it fascinates me in that there is now a lot of companies where I did actually interview someone on my podcast, Len May, who has a company that does the Endocannabinoid testing. So they do genetic testing associated with that, and I found that really fascinating.
It's interesting because I actually work with, not with them, but I work in conjunction with Genomics for Life. So we help develop a lot of testing for the cannabinoids and endocannabinoids with them as a company for the genetics as well. So
yeah, amazing. I think that is just an all-in-one approach where you can then look at all these aspects, and you're guaranteed almost that you can give patients the best outcome by the dosage, the titration levels, the monitoring, and then some of that base level testing. So you're ensuring that these side effects don't happen. Yeah,
absolutely. The low endocannabinoid testing is quite difficult because it's there's a very tight time frame of it, and also of how it's collected. It has to be in dark. I go into the biochemistry or things of it, but it has to be collected and spun straight away, and then actually what's called aliquoted into dark little aliquot things to keep it completely outside of light exposure, and then it has to be frozen straight away. So if it's not collected properly, that actually changes the endocannabinoids of what they're actually testing.
The data, wow, yeah, so sensitive.
Very, very sensitive. So, and then it has to be, once it's actually frozen in -80, it actually has to be analysed within that 2 weeks.
Goodness me, wow. That's fascinating. So with this, I think, testing that I did or was looking at, I think it's more of a cheek swab, so it's run off of my DNA panel, but it's more so for the addictions and also tendencies for schizophrenia. So it's just giving you more just a generalised versus the specific. Yeah, so I think it's slightly different.
Yeah, so I'm talking about blood collection versus a genetic collection.
Absolutely. Yeah. Wow. All right. I need to look into more of that. more homework, more research. All right. So, Janet, we've gone through the patient support, what we would be recommending for them. Now, before I forget to ask you, I really want to ask about myths around cannabis. So it could be to do with the cancer field, it could be to do with research, it could be to do with general practice. Any common myths that you come up against all the time?
There's lots of common myths. Probably the biggest one that I would say is that the higher the dose, the better. So THC is the only component that has anti-cancer activity, which is incorrect. So what I see a lot is that, well, you need to dose them like really high, like 3 times a day, and to get that high THC component to actually have an anti-cancer activity, which is completely incorrect. So what it does basically do is make people sleep all day. So which number one, there goes their quality of life. But you don't actually have to, and this is the myth, is that you don't actually have to keep up those levels within the blood all the time to actually have an effect. Like what we were talking about with the endocannabinoid system and the receptors, if you continue to have that all the time, you're actually going to reduce the receptor numbers and reduce the endocannabinoid response, because they never have a time to actually come back up for air, which is probably the easiest way of putting it. So you actually need to actually have timing. So yes, the cannabis stays within your system between like 6 to 12 hours. They need to then actually have a break for allow your body to re-assimilate for it. So you don't have to be continually giving high doses all the time to have an impact
long term
for what you're actually after. So that would be my biggest myth. Out of everyone.
Absolutely. And it's because, again, the assumed function of normal medicines that are consumed.
Absolutely. What is the half-life of it? How long do you have to give it? And it goes back into that medical model. Well, cannabis doesn't fit into that medical model.
No, it doesn't. And that's, again, it's scary for a lot of people. It's pushing them outside of their comfort zone. A lot of these medical practitioners, they love it, they can hear it, they know what it's doing, but wow, this is really different to what we've been taught. Whereas I feel the field of naturopathy, nutrition, we're already taught to think outside that box initially. We're already exposed to things really early on in our studies, so the foundational model is really different. And that's hard to break after you've been practicing for 30 years or even 20.
Yeah, absolutely.
Yeah, wonderful. All right, Janet. So now I want to quickly touch on, before we go into what you see, and I always like to ask this question right at the end, is what you do for, optimal health, to keep you well. It could be taking CBD, it could be anything there that you have in your daily or weekly practices. But firstly, can we just briefly talk? Now, do you have a little bit more time? Maybe 5 or so.
How much minutes?
5 minutes?
I have 5 minutes.
Okay. Now,
I thought you said 35. I'm like, I don't know.
I want to quickly ask, because Danielle's actually told me, she's like, ask Janet about antioxidants. Tell me the myths about antioxidants, and we can keep it really short there.
Okay. So I wrote a paper on antioxidants, which ended up getting an award, which is my only award for a journal article. But basically, the word antioxidant is just a marketing tool. So we come across this word saying, antioxidants are good, they do all this type of stuff. Well, antioxidants are non-existent. So basically, and we always see free radicals as a bad thing, but both of them is basically a cellular messenger. Now, if we didn't have free radicals, or we didn't have what we'll call them antioxidants, then any interaction within our cells cannot occur. So as we said, like it's a very misleading word that's been used for a lot of marketing tools, but it's also been used in a lot of medical terminology. And probably Danielle actually brought it up too, because even when I was teaching and stuff like that, said, don't come and tell me it's got an antioxidant activity. You tell me how it works, its mechanism of action. Because and that's where we also see some of the research coming out and say, like, antioxidants, have negative effects. And we all go, oh, but they do.
Mm.
So if you overdose on one particular area within the actual body and you suppress a function of certain, let's say, like we call them free radical type things like SOD or hydrogen peroxide, you actually then stop that function. And that could be an enzyme function, it could be a cellular type function, and that's not necessarily good there. So you can actually throw the body's homeostasis out for it. And that's why I said they're not antioxidants. What we're calling, this should be called, is like cell messengers. And everything needs to be in balance. Yes, you can actually say, let's say turmeric is considered to be an antioxidant, but it doesn't have an antioxidant capabilities. It has anti-inflammatory type capabilities. It doesn't suppress free radical production. IV vitamin C is both a pro-drug as well. Like when it gets in higher doses, it actually produces hydrogen peroxide inside and outside of cells. And
that's in cancer treatment. It's used as an immune suppressant. Isn't that correct?
Correct.
Because it's cytotoxic at a high dose. Is that right? Yeah. So that blew me away when I heard that comment, and definitely I think wording around antioxidants needs to be changed, and I totally agree with you in all of that. But we have been taught this, and this is us having to step outside our brain and our modelling, because I feel that antioxidants has been drilled into us through our degrees.
I totally agree with you, and that's one of the reasons why I usually stand up and say it's incorrect, and then everybody goes, how can you say that?
Well, you've done research now,
Absolutely, I can show you.
Yeah, absolutely.
You need to stop using the word antioxidant.
Because antioxidants then seen by the general public as something that I must always have antioxidant, fighting against. But again, we forget this homeostatic balance that we're always meant, too much of anything is a bad thing. So we're always having to come back to this balance. And the same thing with, that's why high dose, and I know now, high dose vitamin C is used more frequently on cancer patients, because you're actually trying to knock out almost or stop certain cell processes. On a normal healthy body, you don't want to be doing that. Yeah.
Correct.
Makes sense. Yeah. Totally makes sense. Well, I think that is a talk for another day. I think there is so much more to unpack for that. But I just wanted to quickly bring that in there because I really wanted to get that out into the world.
Good. I'm happy to spread that as much as possible.
Extra confirmation there. Now, Janet, final piece. Tell us what you do or what you love to do to keep you well, because as we explored already, you're a busy lady. You've got research, you've got a clinical practice that takes a lot out of you emotionally. You're so passionate about what you do. You look after students, the list goes on. And we haven't even touched on your life, family life. So we all have so much that we've got going on always. How do you look after yourself the best?
I guess it's also over time is that I compartmentalise certain things so that I don't try and carry things over. I have routines that I actually do that actually helps. I have a set time where I will switch off. I will take the dog for a walk, and that's my then downtime.
Yeah. I can see. Is it a he? He's just laying on the couch there.
It's a she. She's a resident. Yeah. I will sit down, I will have a glass of wine, and then I will get up and then do dinner and stuff for my kids and family and all those. So it's part of those routines. Also for when I have a patient pass, obviously which happens in cancer, I have a little routine with that too, where I will light a candle. I've got a playlist, a Spotify playlist that I play and, give honour to the person and hopefully that they're now free and work through that, because as you're right, like I'm not just going to take it as an everyday thing, but every person really means a lot, and it's also about honouring their life and what they have contributed and contributed to me as well.
Absolutely, both teach to each other.
Absolutely. And obviously there's exercise and there's other routines and stuff, but I think self-care is really important. But I also think making sure that you have that ability to, needing to stop
Mm.
and it's setting boundaries.
Yeah.
Otherwise, I'd go crazy.
Absolutely. And thank you so much for sharing. I think it's so beautiful that people need to actually realise that, especially as practitioners coming into this as well, they don't realise how much you can take on from other people. But I love that you do that. I love the candle and the honouring, because it allows you also to set that free, and it allows you not to carry that forth, but also to honour that person, what they deserve, and the journey that you've had together. And, you know, nothing's going to change the outcome at that point, but it really does help you move forward and move through that, and then keep helping people, because without, you know, you get stuck in that emotional turmoil, and then you're not able to help more people, which then, you know, doesn't benefit anyone, I guess then.
Exactly.
Yeah, amazing. Well, thank you so much for sharing that, Janet. It's been an absolute pleasure talking to you today. And thank you so much for all the work you're doing and the knowledge that you're spreading. And I really hope we get to catch up again, and maybe we can talk through more research that you're doing in the future, and then on antioxidants a little bit more, plus lots more, because we didn't even get into herbal medicine today, which I really wanted to, but we will save that for next time.
That's great. I would love that. I totally love this conversation.
Beautiful. Thank you so much, and I will talk to you soon.
No worries. Thank you.
Thank you for joining us on another episode of the Smarter Not Harder podcast. If you enjoyed today's show, we would greatly appreciate if you could take a moment to leave us a 5-star review on Apple Podcasts, Spotify, or wherever you listen. And don't forget to subscribe to our YouTube channel for more insightful content. We hope that this episode has expanded your understanding of the fascinating endocannabinoidome and its impact on our well-being. Remember, knowledge is power, and we strive to bring you the 1 cent solutions to those $64,000 questions. Thank you for tuning in to the Smarter Not Harder podcast, your go-to source for insightful discussions. Stay curious, keep learning, and we'll see you in the next episode.